morning, good evening, good afternoon, wherever you are. I'll just excuse my voice. Firstly, I've come down with a cold, so I'll keep it very brief before I hand it over. But I'd like to say welcome to International Energy Poverty Action Week of 2023. It's really a privilege to be able to introduce this second edition of the event. We had our first one last year in 2022. As Anna-Marie said, I'm a PhD student and a researcher at the University of Manchester in the UK, and I've been one of the organisers of the event. So what is this week about? It really kind of came out of conversations starting within the Poverty Project and the University of Manchester, and then that grew to involve several organisations across the world who were involved in some way with energy poverty, energy efficiency, renewables, and kind of growing the conversation around the need for representation and diversity and a space for voices that aren't usually heard within the energy poverty space. It's really dominated by European voices, and we felt that you know, in this to be able to solve this global issue, we need to have global representation and the inclusion of different voices in the debate. Our sort of ethos is that we believe that everyone has the right to clean, affordable, and renewable energy. And we're promoting knowledge sharing on a global scale between academics, policymakers, practitioners, everyone really. Everyone's invited, everyone's included, and we hope that that will accelerate sort of actionable and replicable solutions that challenge social inequality, reduce energy poverty, and hopefully slow climate change. That's what the event is really. And this year we've divided the week into 5 key themes. So today will be about health. Tuesday will cover social impacts and the way that different vulnerabilities intersect with energy poverty. Wednesday is going to cover the economy in different ways that we can invest in and finance energy poverty solutions. Thursday, we'll look at policies and sort of how we make those socially sensitive in the face of the global energy crisis. And then finally, Friday is going to look at futures to promote youth voices and sort of the future of energy poverty and climate change. So we've got a fantastic lineup. We've got great speakers from all over the world, from Argentina to Israel, from Nepal to Burkina Faso, Italy to New Zealand. And we've got registrants from over 60 countries at the moment across all continents. So I think that's really great. And I'm really proud to say that we've put together this event that is really international, and we hope that that's reflected across the sort of expertise and the knowledge that's shared across the week. So I'll just do a little plug. So you can keep up to date with all of the action over on our Twitter page, that's at Energy Poverty WK, and also on our LinkedIn and our website. We've also got a Twitter storm going on, which has been put together by us and the Right to Energy Forum, and we're asking everyone to go over to Twitter and tweet, if you were an energy minister, what would you do to act on energy poverty? So if you'd like to be part of that, you can go over to Twitter. We ask that you use the hashtag #ActOnEnergyPoverty and our International Energy Poverty Action Week hashtag, which I'll post in the chat so you have all the information. And really boost that and make that successful. So just lastly, it's been, like I say, an absolute privilege and joy to work with this amazing and dedicated team of people. I'm not going to name you all, I don't want to miss anyone out, but huge thank you to everyone that's been involved. It's been really fantastic, and everyone's put a huge amount of hours in. So I hope we can make this a success. And Anna-Marie, Teresa, over to you. Thank you so much.
Thank you, Manon, and I will start opening the session because we really have a good speakers and it's really packed day for 2 hours. So we will jump in and I will announce you Teresa. She's former member of European Parliament from 2014 until 2020. During the time she was more focused involved in fire safety and energy poverty, and she also led European Parliament in Manifesto on Energy Poverty and establishment of European Energy Poverty Observatory. So she's now chair of the Forum for European Electric Domestic Safety, and Teresa will share the presentation, give you the floor, and you can present your ideas and just put me here. Okay.
Thank you, Anna-Marie. Thank you, Manon, and welcome to the Brussels space to people from right across the world. And I'm absolutely thrilled to be involved in the International Energy Poverty Action Week and the fact that we are keeping the work going on energy poverty. Anna-Marie, if you could share my first slide. In 2023, next one, Anna-Marie, no one should have to choose between eating or heating or cooling their homes. As Anna-Marie said, from 2014 to 2016, the European Parliament adopted its first ever energy poverty manifesto. We did not have an energy poverty manifesto in Europe before this time. So why did I get involved in energy poverty? I was a city councillor in Liverpool in the UK. And I had a single mum come to my surgery with 3 children, and her energy supply had been disconnected. How could those children do their homework? How could they be comfortable? How could they be healthy? I didn't know what to do. So I took them home with me. So when I was elected to represent the northwest of England in the European Parliament, I was determined to do something about energy poverty in legislation. And I workshopped the early work with civil society, trade unions, the energy poverty community, the fire safety community, and trade unions. But I was a Northern MEP, so I stood up in the first meeting and I said, in 2014, nobody should have to choose between eating or heating their homes. And 2 hands went up. And it was a Spanish MEP, Soledad, and a Maltese MEP, Miriam, who is now a minister in Malta. And they said, Teresa, in Spain and in Malta, in the summer, we have long-term sick and elderly people dying because they can't afford to put their air conditioning on. So the mantra for the Energy Poverty Manifesto in Europe became, nobody should have to choose between eating or heating or cooling their homes. Recently, a mother and child tragically died in Antwerp from using a portable barbecue for heat in 2023. A child in the UK died recently, and a coroner found that his death was actually linked to the damp conditions of his home. There have been deaths in Spain recently due to candles being used for lighting. There is a direct correlation between energy poverty and health. In 2022, working with the energy poverty community, the Forum for European Electrical Domestic Safety, FEEDS, which I am proud now to chair, established the link between energy poverty and fire safety. Our poorest live in the leakiest and least fire safe housing. The link between living in a cold, damp home and the stress of attempting on a regular basis to make ends meet and poor health has long been recognised. In addition, in hot countries, elderly people, the long-term sick and housebound are dying because they do not have or cannot afford to put their air conditioning on, and climate change is resulting in record temperatures, as we know, right across the world. The impact of low indoor temperatures on health was established by the World Health Organization way back in 1985, but we must work collectively to do something about it. In a report for Save the Children, Professor Christine Liddell found out that for every pound spent reducing fuel poverty in the UK, the National Health Service would save 42 pence. So this is economic, social, cultural, and just. The connection between fuel poverty and health is based upon the health implications of living in cold, damp, or excessively hot homes. Those who are fuel poor are more likely to turn their heating down below the level adequate for their well-being, or not turn on their air conditioning in the heat. In Northern Europe, a cold spell during an otherwise mild winter, depending on its duration, can see the following. After 2 days, there is a sudden rise in heart attacks, up by 1/3. After 5 days, there is a big rise in the number of strokes. After 12 days into a cold spell, there is a rise in respiratory illnesses such as asthma. And it was the link between cases of childhood asthma in Poland that enabled Poland in Council to embrace the clean energy package, a direct correlation between poor air and children's health. In most Northern European countries, more people die in 4 months from December to March than during the rest of the year. Now, in Southern Europe, more people are dying in the summer, but we need more qualitative and quantitative research, and we need a worldwide definition of energy poverty. Contributing factors include low income, inefficient heating or cooling systems, external temperature fluctuations, and excessive damp and mold growth associated with poor housing stock. Fuel poverty has a detrimental effect on our health and well-being, including our mental health. Living in a cold, damp home can increase the rise of cardiovascular problems, especially amongst vulnerable people. In cold temperatures, blood tends to thicken, leading to an increase in blood pressure and increased risks of heart attack and stroke. Mold exacerbates illness such as asthma, and fuel poverty impacts mental health, leading to stress, anxiety, and depression. Children in cold homes are more likely twice to suffer from breathing problems when compared to those in dry and warm homes. And poverty is a known risk factor when it comes to poor mental health, and living in poor housing also has a negative impact on child's education, their aspirations, their life chances. Children living in poverty also struggle to concentrate in school if they're tired or they're hungry. The UN's Sustainable Development Goal 7, access to safe, efficient and affordable, is still not applying for people in energy poverty throughout the world. Anna Maria, if I could have the next slide. Contributory factors: low income, high fuel prices, poor energy efficiency. The cheapest fuel is the fuel you don't use at all. Obsolete and old electrical installations, poor non-existent electrical inspection regimes, bad landlords, reliance on fossil fuels, deprivation, energy in crisis, the increase in use of solid fuels, bad for the health, bad for environment, bad for the air we breathe. Energy poor live in the leakiest and most energy inefficient and least fire safe housing. Therefore, their energy bills are higher and they are more exposed to health and fire risk. This cannot be right. We cannot fail our energy poor, expose them to higher pricing and poor housing and unsafe electrical installations and fire risk. Access to energy is not a commodity. It is a basic social and human right. Thank you.
Thank you, Teresa. You really good introduction to our Energy Poverty Week and Energy Poverty with Health issue. And I think that all the next presentation will really good balance the actions that you proposed, and we need to do more. So I will introduce our next speaker. She's Nina from New Zealand. She's in the really last hour of her day. So our 2 hours of event for New Zealand, it will be 2 days. She will jump in. She's, as I said, from New Zealand. She worked for 50 years in the sector of energy sector. She now works for Ministry of Energy and Resources in New Zealand, but she has experience in Europe, where she put her expertise in energy efficiency, alleviating energy poverty, promote health. And this is something that she will show us what is going on in New Zealand. For me, it's really interesting thing that in New Zealand, they call energy poverty, energy hardship. And I think it will be great to hear what is going on in New Zealand. Nina, you can share your presentation. And Teresa, thank you. Stay for the round table.
Thanks so much, Anna Marie. I'm just working on sharing this. Hopefully that's working.
Yes, just put it in presentation mode.
I'll try that again.
Let me see. Okay. Okay. Just so we see it, and you use the double screen, so we are seeing. Okay.
Okay. I'm going to try again.
Yeah, it's shared, and then in the left corner there's I call it hours, and just put it there. Click, and it will be in presentation mode. Yeah, we are seeing it.
Is that working?
Yes. So,
Okay.
Nina, the floor is yours.
Okay, great. Thank you very much for that introduction, Anna Marie. I'm really excited to be part of this conversation. As you mentioned, I currently work in New Zealand for the New Zealand government on energy poverty issues, but previously worked at the IEA, so really passionate about this global dialogue on this topic. So thrilled that this event happens and really honored to be part of it. So I'm going to talk a little bit about what's happening in New Zealand. There's a lot going on in our end, so I'll just talk you through some of the what, how, and the why around how we're approaching the problem, and the why gets into the topic of today, the link between health, well-being, and social outcomes, which we've recently got some brand new results from a couple of our big programs in New Zealand. So I'll share that with you. So the what, how do we describe energy poverty in New Zealand? Well, as Anna Marie foreshadowed, sorry, first, where am I going first? First, I thought I'd better start by giving you a bit of a snapshot of where we are in New Zealand and what the situation, in particular in relation to housing, is like, for those of you who don't know. So you may be aware that we're a pretty small population, and we predominantly live in single detached dwellings, usually from wood, weatherboard construction, and have a long-standing problem with the energy efficiency of housing. So we've only had requirements for insulation in walls and floors since the 1970s, and we still have a lot of work to do to retrofit those homes. We also have about 10% of homes without a fixed heating source, and 20% that are reported as cold and damp. Electricity is our go-to fuel in New Zealand, being largely renewable and also relatively affordable. So what we're doing at the moment is looking to firm up a local definition of energy poverty, or as we call it, energy hardship in New Zealand, and also to develop measures to help us to start tracking that and hopefully track some progress in this area. So what I'm showing you here is the results of the research and review that was undertaken by New Zealand government in recent couple of years. And what you can see is that actually, although energy hardship was the concept we started with, the results of that work actually pointed to the need for a more aspirational, strengths-based framing for energy hardship. So now we talk about a spectrum, which sort of moves away from that stigmatization of the negative frame of energy hardship and recognizes the fluid nature actually experiencing energy hardship, that is not necessarily a permanent state, but actually a sort of fluctuating, moving target, as we know, with the various political and environmental events that take place. People are moving in and out of hardship and hopefully progressing towards energy well-being. So I won't go into the detail of the definition laid out here, except to point out the use of some Māori phrases and words in that definition. Māori are the Indigenous people of New Zealand, and sadly strongly overrepresented in energy hardship. So it was a really important piece of this work to make sure that they showed up in this definition. Also, just give you a quick look at the framework that we're using in New Zealand for energy poverty. So going beyond the traditional three drivers of energy poverty, this allows us to look a little more deeply at the various solutions that might be available and the actors that would need to be involved in that across a broader range of issues. And we're still working on the measures that will be used to track energy hardship. They'll be coming out in the next year or so, but intending to focus actually more on the subjective aspects of energy hardship in New Zealand. Really strong feedback from the public consultation around that expenditure-based measures are very difficult to interpret without subjective information. So I'll move on to the how, where I'll just give you a little bit of information about some of the key programs that we have going on in New Zealand. And then I'll move on to the results we're finding through some of these. So our real flagship program in New Zealand is the Warmer Kiwi Homes program, previously known as Warm Up New Zealand, which some people may have been familiar with because of the significant evaluation that was done of that about 10 years ago. But the program now still provides subsidised insulation and heating for low-income families. We've also got the Healthy Homes Initiative, which is a really powerful program. It's unique in that it's a much more holistic intervention, does everything from basic repairs to poor quality homes through to energy efficiency advice and equipment. And also what's special about that is that it's targeted through the health system. So GPs are referring patients who are displaying health symptoms that are known to be linked to poor housing quality into this program, and then they have access to this full range of measures. We've also got housing standards for rental properties, and there are some pilot activities around education in communities and also supporting renewable energy generation at the local scale to address affordability. I wanted to draw your attention as well to the work of the Energy Hardship Expert Panel. This is a piece of work that I'm involved in right now, which is just about to draw to its close when the expert panel presents its policy recommendations to the Minister for Energy in June this year. So that is going to be a very exciting time, hopefully an opportunity for some significant steps forward in the policy space. But today I'm going to talk to you about the results that we've got that are really driving all of this policy change. There's a whole range, as Teresa alluded to, of drivers and impacts from energy hardship, but certainly the results that we have seen in terms of health benefits is a real driver in New Zealand. And we do have a large body of evidence on that in New Zealand. So there's a general acceptance of that link, particularly around the role that housing quality in the indoor environment has on health. And just as a reminder, this is the sort of causal pathway that a lot of you may be familiar with around that indoor environment and the measurable health outcomes that it gives rise to. But what we've been aware of is that there are still gaps in our knowledge, not so much around how the indoor environment affects health, but actually how the interventions individually contribute to an improved indoor environment. So that is what we decided to look at with a new study on the Warmer Kiwi Homes program. So sort of a 10 years on update and digging into some new issues that weren't covered in the 2011 evaluation. So this time we were interested in, yes, whether homes are warmer and drier and by how much and why. And we're also interested in the role that occupant behaviour has on that. So the choices that are made around operating the heater. or the heat pump in our case. And then also, we understand health, but what about the wider well-being impacts and social impacts of that flow from that, or might sit alongside that? So we commissioned a 2-year study with approximately 160 households, and it ran for 2 years. So it covered 2 winters and an intervening summer, which was great because it gave us the opportunity not only to get the bonus of summer measurement, which is less of a priority in New Zealand, but likely to become one with climate change advancing, but also gave us a chance to look at the durability of some of those results from one winter to the next. So we installed, I say we had a great team of researchers commissioned to do this work. But after doing a house condition survey and participant survey before the intervention, they went and installed sensors in the living rooms before the intervention, and then an energy monitor along with the heat pump at the time it was installed. And then conducted some subsequent surveys after several months of living with the new heating system, and then the following winter as well. So what did we find? Positive results all round. So first of all, a statistically significant increase in the temperature inside those living areas of 1 to 2.1 degrees. And notably, those temperature gains were most significant at key times, breakfast time and dinner time, when the whole family's gathered in the house and usually trying to warm up after a cold night with all the heating off, or a day out of the house. So really important benefits there. We also saw a 6.4% reduction in humidity, a really major issue in New Zealand's very wet climate. And surprisingly, a 16% reduction in energy use, which was a real change from our previous study. We all know, and Teresa alluded to it, that families in energy hardship are chronically underheating their homes in a lot of cases. So to see that there was actually an energy saving in addition to the health benefits that we spotted was really encouraging from a policy perspective as well, from an economic perspective. So in terms of the comfort and behavioural indicators that were brand new information for us, we had really exciting results. 80% of households said that they were much more comfortable or much more comfortable after having the intervention. So that's a subjective comfort measurement. Also, 70% were less likely to restrict their heating. Really important for energy hardship, as we've discussed, and a 15% improvement in life satisfaction, which is the result of a bundle of measures borrowed from the World Health Organization structure for measuring well-being. That's relatively small, but quite pleased with it, particularly in the context of COVID-19 and lockdowns that were rolling through New Zealand at the time the study was underway. So there were a lot of things affecting people's life satisfaction, in addition to poor housing quality and high prices. But really exciting results for us. And I just wanted to emphasize in particular that piece around the change in the need to restrict heating. So this graphic just shows you that before heat pumps were installed, about 80% of the households that were being observed were sometimes, often or always restricting their heating due to cost. And after the intervention, that completely flipped on its head, and suddenly 79% were never having to make that heat or eat choice. So that is really gets to the heart of what we're trying to do with these programs, and really powerful results to promote the extension of the program and hopefully the development of some deeper measures. Just before I finish, I think I'm just about at time, but I wanted to share with you another package of results that came through about the same time, just right at the end of last year, before Christmas. And that is the results of a 3-year evaluation that tracked the Healthy Homes Initiative that I described at the beginning, the one that's targeted to people with existing health conditions. And they did hone in very specifically on the health impacts and the results of that. And again, really positive results came through, that they saw a 19.8% reduction per year per patient in hospitalizations. And not only that, but for those that were hospitalized, those stays were shorter and less severe on average than their previous hospitalizations for that individual. They did also get some really interesting results around some of the broader social outcomes. School attendance went up, employment, and also equity in health and social outcomes, in the sense that this program made a really meaningful difference for those groups that are typically overrepresented in energy hardship and underrepresented in socioeconomic statistics, Māori populations, as I mentioned at the beginning, as well as Pacific Island people living in New Zealand. I encourage you to go into these reports and have a look at the figures. The improvements in those areas were small, but statistically significant in the sort of 3 to 5% range. And the really good bit of news about this one as well was that there was a return on investment within 1 year. This is, as I said at the beginning, a much deeper and more comprehensive program that relies on partnerships and multiple interventions. So to be able to get a return within 1 year was really positive. The Wamakiwi Homes program, on the other hand, has a 4.3 to 1 return. So it's just an overwhelmingly positive program. But I'll stop there, Anna Marie. I think I'm about time, but thank you very much for the chance to share. And do take a look at our website.
Yeah, it was really nice to see what is going on in New Zealand, and Nina will stay for the roundtable, so a question could be asked after this. And we from New Zealand, we are going to jump to Burkina Faso, and you go by Ardugo. I really think I pronounce the name and surname. His expertise from Burkina Faso. He has experience of 25 years in managing of experience in rural development, forestry, agriculture, climate adaptation, mitigation, invest in East Africa, especially in Burkina Faso, Mali, Niger, Ghana, Guinea, Kenya, Ethiopia. So if he's presenting Burkina Faso, you can also ask questions about other countries because he's really involved. Thank you.
Hi, Anna-Maria. Hi, everyone. I'm very pleased to be here with you. Very exciting day. And I hope I can find time to attend the remaining days, the next days. Yeah. Can you see my screen?
Yes.
Yeah.
Yes, we can see it.
Great. So, yeah. Okay, great. My presentation is more about a literature review on the nexus on health and energy from African perspective. Here is just to provide a background. As you may know, I'm currently a PhD candidate in development finance at the University of Stellenbosch Business School in South Africa. And my research investigates the economy-wide impact of public and private investment in energy infrastructure, transport, and telecommunication. That's just to provide a background. In that study, we assessed the impact of energy infrastructure on macroeconomic indicators, microeconomic indicators, socioeconomic indicators, as well as social indicators, including health, education, equity in the environment. Here you see the theoretical foundation, the methodology we use, the social accounting matrix for Burkina Faso, and we develop a dynamic, computable general equilibrium model in which we computed investment in energy to determine the macroeconomic effect. On the literature review, the nexus between energy and health, here is a bit some of the review of the literature. It is well known, documented that African infrastructure is very low. For instance, McKinsey has found that more than 2/3 of the world population with no access to electricity is based in sub-Saharan Africa. This represents about more than 600 million Africa who do not have access to electricity. African countries' access rate is about only 40%, which is the lowest in the world. For example, in the United States, they have more than 10,000 kilowatt hours of energy per capita, while in Africa we have only 180, which is very, very, very small. And this is despite the continent, Africa, having huge potential in the energy sector, especially renewable energy. And also in the continent, we have a potential for solar, biomasses, wind, and geothermal energy. The African Development Bank estimates that Africa, compared to Latin America and Asia, only 40% of the population have access to electricity, compared to 97% in Latin America and 89% in Asia. It's not only about the quantity, the stock of energy infrastructure. It's also scarce, it's expensive, and not at all reliable. And as a result, many small businesses suffers from power outage on the continent. Now, what's the link between energy and health? It has been well documented that in Africa, most people, they use cooking stove, and developing, for instance, sources can prevent death. And also it will facilitate the operation of hospital emergency service, as well as education outcomes that previous speaker mentioned. It is also known that energy is a key driver for inclusive growth, and it can create opportunities for the most vulnerable sections of the community, most notably women and youth, as well as children. There are several microeconomic studies that establish the link between energy and health, as well as nutrition and educational outcomes in developing countries. Power infrastructure, especially the availability of it, is vital in delivering services in hospital, and hospital proper functioning require reliance on energy to maintain, for instance, medicine and vaccine, not to mention urgent intervention. It's quite common in our countries, especially in Burkina Faso, that during urgent intervention in health center, there are power cuts, with more people dying because of the lack of a reliable source of electricity. And also, access to clean energy is critical and could help really reduce pollution. And the World Bank estimates that more than half of the population in the developing world still rely on biomasses, especially wood and coal for cooking and heating. So there are also additional studies that demonstrate that indoor air pollution has some significant health issue on people. And investment in water and sanitation powered by electricity can also have significant impacts on health, especially among children. I've mentioned the benefit of access to safe water powered by energy, and McCarthy, for instance, reported that increased access to water significantly reduced the incidence of malaria, for instance. So what can we conclude from the literature review? It's obvious that there is a unique directional causal link that is running from energy to health in developing countries. Perhaps health can also improve the provision of energy, but I didn't find a relevant literature on this subject. However, there are policy considerations. There are key issues for policy consideration. Increasingly, scholars and academics are studying infrastructure as a system, linking energy provision to transport infrastructure and telecommunication. Studies demonstrated that a single infrastructure may not be able, given the deficit of infrastructure in the continent, to spur economic growth. And also there is a need to study, to not consider only the quantity or the stock of infrastructure, but also the quality and access dimension of infrastructure. Here is very briefly what I wanted to introduce. So pleased to meet all of you, and thank you so much for your attention. Thank you.
Thank you, Jakub. I think that you really got us really good review of literature and what is going on in Africa to maybe have idea to do some actions and to see what we can connect as a European results and action to Africa and what there is could be done. Thank you very much. I know that you have other things to do and you cannot stay for the round table, but we share your connection to LinkedIn, and if you have questions, really put to Jakuba, he'll really answer it, and I'm glad that you were here.
Thank you, Ana Maria. Thank you, everyone.
Thank you very much. So from the Burkina Faso, we are jumping to Israel, and I will going to present you Batizon Ben David Gerstmann. She's Director of Regulation, Policy and Public Participation in Israel, Ministry of Energy, and during the last year, she's really focused on promoting issue of energy poverty within the ministry, government, and also with corporation, with academia and civil society. So Batizon, the floor is yours. Give us what is going on in Israel after New Zealand and Burkina Faso.
Thank you, Anna Marie, and I'm very happy to be here to share and especially to learn from all the other presenters. So thank you for inviting us. I'm going to, let's see if I can get over the first challenge of sharing my screen and moving to, are we in presentation mode?
Yes, now we are in presentation.
So I'll say just in general, as Anna Marie said, energy poverty and energy burden isn't even in my job description. Is something that I've come to work on in the last year or year and a half. And overall, as a matter of policy, it's still developing in Israel. At the same time, on the level of action, we do have a few interesting things that I wanted to share. I'll just check the time so I don't go over. Just some basic information about Israel before we get into the issues. So first of all, population of almost 10 million. We're one of the few OECD countries with a rising population and a high birth rate. So all of our planning towards net zero, towards the SDGs, we're always very aware of the fact that our population is going to continue to rise. We're going to have rising consumption of energy, of housing, and of other resources. We're a fairly small country with a very diverse climate. We have significant desert areas and some mountain terrain. Cold is an issue, but not as significant as it is, I think, in European countries. When I think it was Teresa who spoke about Malta and Spain, that's much closer to the climate in Israel. We don't have snow every year. When there is snow, it's reported on the news. So it is very exciting. At the same time, so our biggest challenge is heat. I'll explain in a little bit. But cold is also a challenge. In certain areas of the country, we're also prepared for cold. Our primary source of heating and cooling is electricity, is air conditioning. Very high rate of homes are connected to electricity, and air conditioning is very popular. If you go countrywide, we have about 90% of households have electricity, and even in the lowest income decile, the lowest 10% of income, 82% have an air conditioner, which is a good start. It can also be confusing because the air conditioner isn't necessarily efficient. It doesn't necessarily work. It isn't necessarily new. And then some families technically have an air conditioner, but it's not effective or they can't afford to turn it on. But we do have that network. We don't have a lot of fossil fuels or wood in homes. And we do have a central utility system, even though there is now some more competition in the energy generation sector. We do have one very large public utility that also, I think, sees itself as having responsibility on many issues, and they do a lot of outreach and an explanation of their different situations. So that's Israel in general. Preparing for today, I said I wanted to think what were the challenges in energy poverty in general, and also in health, which is today's theme. So, so these are the four, and I'm going to talk about most of them. I'll start with the last one because I'm not going to get into off-grid communities too much, but it is important for me to say that we do have in Israel off-grid communities, mostly in the south, mostly Bedouin and ethnic communities. It's a challenge that is much larger than energy. It's a social and economic and housing challenge. So I'm not going to discuss that today because I don't have enough information about it, but there is a lot of research and action being done on that as well by people here in academia. So what were the big challenges I wanted to speak about? We'll speak about the first one is our primary concern. I apologize, this slide is partially in Hebrew. I didn't have time to translate it. Our main concern is the expected rise in hot and very hot days over the next 30 years. And what I just wanted to show here is the different areas in Israel. And you can see that here, I'll see if you can see with here, like in the center, if we're talking about an increase of how many days in 2050, we're going to have 10 more days a year that are over 30 degrees, and we're going to have 10 more days that are over 34 degrees Celsius, of course. We're expecting a very significant increase in very hot days. Same is true in the Jerusalem area, which is a lot colder, still significant increases of hot days, like over 30 degrees, very hot days, over 34 degrees Celsius, and even extremely hot days, as you can see in some areas here in the north. We have days, we're going to have 25 days a year of over 38 degrees. That's incredibly hot, and also towards the south. And there was a study, a long-term study done by two people in academia and also in cooperation with our Ministry of Health that found that there is higher mortality during heat waves. And they did a long-term study over 8 years, and they were able with, I don't have all the data here, but it's available online in Hebrew, I believe. They said that every heat wave had about an additional 45 deaths that were caused during the heat wave. I can't say what's exactly because of the heat wave, but we know that this is going to be a significant health issue. So this is the first thing I wanted to show. Another challenge that we have has to do, like we're talking about with energy poverty. And I want to say a few things of introduction before I go into this slide. First of all, Israel does not have an official definition of energy poverty. So we don't have official statistics about it either. What I am going to be using here is a study by a civil society organization, a nonprofit that focuses on on food insecurity. The Latet is a wonderful organization, and they focus on families that need food and help them with food insecurity. And they put out a study every year about, they call it the Alternative Poverty Report. And this year they also discussed energy and energy poverty. And they found this square up here that over half of the recipients of, sorry, I spoke a little too fast. The people who answered the poll were only recipients of this organization. So they were only people who are experiencing food insecurity. And they found that over half of those people had either had their electricity cut off or they received disconnection notices in the last year. Many of them, over 3/4, either don't have any heating or cooling appliance, or even if they have it, usually or often refrain from using that appliance due to cost. And the researchers who did this study, their names are down here, Naamat Teschner and Stav Shapira, found clear statistical correlation between energy poverty and chronic illness and, hold on one second, and loneliness. And those are things that we know will definitely affect both physical health and mental health. So we see the correlation. We don't know the causation, but we know that this is something that needs to be addressed together. And another thing I wanted to mention is the question, which we've been treating for a long time already, is what happens if my home runs on electricity and I have a critical medical appliance? I'm on a person is on a respirator, or if they have medicine that has to be kept cool and I can't afford to pay my electric bill, what's going to happen to my health? So that is something that already was taken care of by our electricity authority. We have, and here I'm already going a little bit into the actions that I wanted to present. So let me see, I have a few more minutes. I'll talk quickly about each one. So I'm starting on the left side of the presentation on existing measures. And these measures, I have to say, they exist for a long time already, even before we discussed energy poverty. And I think when I started talking to people in government about energy poverty, they said, I don't know what that is, but we do these things. And I said, oh, wait a minute, these do address energy poverty. So So first of all, I'll start all the way on the left. Israel has in place and has had for a long time already both a warm home grant that is given primarily to elderly people and subsidies, a subsidized electricity rate based on different criteria. The criteria isn't directly related to energy poverty. It's families who are poor or have certain cases of disability, certain eligibilities of our social security system. So it does help to alleviate energy poverty, but it doesn't always have the exact effect, and we can't always measure the effect, but we know that we do have this existing measure. Another existing measure is protections from being disconnected from the electric grid for low-income households and for households with medical needs. This is a protection that has been in place for many years and has been recently expanded. There was a court case with our Supreme Court, which eventually compelled the Electric Authority to expand the protection. The protection always existed, but they added more medicines, more medical appliances, and they created another category of people who are suffering from a very significant hardship, economic hardship. And the estimates of our Association for Civil Rights is that now about 380,000 households will be protected from being disconnected from electricity due to debt. It doesn't mean that their debt is forgiven. There is still a process of debt collection, but and this doesn't solve, I don't want to say that everything's wonderful and that we've reached a perfect solution, but we do have these measures in place to protect these households when it comes to the direct electricity consumption. So those are things that we've been doing, and I wanted to spend a few minutes saying what we're starting to do now. So one very important measure that's actually not happening exactly in government, it's happening in academia, but the professors I mentioned earlier, Stav Shapira and Nama Teschner, are starting a countrywide research to define and map energy poverty in Israel. It's a private initiative. It's being supported by the Ministry of Energy and funded. The research is being funded by the government, but it's an independent initiative to for the first time have a definition that is appropriate for Israel. Often when we look for other countries' definitions, then I see a lot of definitions have to do with fuel or with cold, and we know that that isn't what we need here. We realize that there is a need for a very specific and appropriate definition for the Israeli climate and Israeli patterns of energy consumption. That's the first thing that's happening. It's a work in progress over the next, I think, 2 years. We're going to see the academic route. And the other thing that we're working on is developing municipal action plans for energy poverty. We decided to kind of do this bottom up and say we could wait and have government-wide consensus over a definition for energy poverty, or we cannot do that because that would take getting a lot of political and professional will. We said, can we do this bottom up? Can we go to 1 or 2 municipalities and work with them to start having an action plan? And even if the definition won't be perfect, we're going to learn as we go. So we're starting this with one locality. We believe that 2 more are starting to work on this as well. So we're trying to build this topic bottom up, and we're working on both defining energy poverty on the one level, but already working on the solutions to energy poverty that are required in Israel. So we're still early days for the measures on the right of the slide here. And I guess that's it. I'm happy to be here, keep learning and getting more ideas from other countries. Thank you.
Baptism. You really got us really intros after New Zealand and Burkina Faso. I think it's really great to see what's going in Israel. I know that you're really involved in energy poverty, and now that we have few presentations after you, they are more like European centric. We are more involved. We are more in action doing, and I'm glad to announce Anna Zofia Bayomi. She's policy officer from FENSA, and she's working on energy poverty, and her background is really in social policy, and she will going to present us what is going with energy poverty and firewood in Central Eastern Europe, especially now with energy crisis. I think it's really good to see what is going on, what was the data, what is the solution. So Anna, the floor is yours, do the presentation and see what is going on now after all the 3 countries in Europe.
Hello everyone, thanks for the introduction. I hope you can see my slides.
It's not in presentation mode. I see the presentation.
Yes.
But...
Okay, I try to fix that, just a second. Okay, open. Okay, now it's working.
Yeah, now you see. Now we see.
So
Great.
I'm working at France as an energy poverty officer, and I will focus on solid fuel heating in Central Eastern Europe and its health impacts. While I was doing my PhD on the issue of firewood heating in Hungary and the impact of energy transition policies on firewood users, I discovered that the topic of solid fuel heating is mostly explored in the context of the Global South, and there is not much literature regarding it in the European context. However, firewood heating is really a predominant form, especially in the Central Eastern European countries. So to show you a chart about some data on the share of solid fuels from final energy use of households, you can see that in Central Eastern European countries and some southern countries, the relevance of solid fuels, especially firewood, which is the blue color, is really important, arriving at some countries up to 60%, and in the whole EU is reaching 30%. So it's a really relevant form of energy source. Solid biomass can be used to produce heat in centralized forms, but also at the household level with boilers and individual heaters. And while it is relevant from an energy poverty perspective, as you can see in Hungary, the poorest households heavily rely on solid fuels, which is mostly firewood in the case of Hungary. And as the income is increasing, the importance of firewood is decreasing, and gas and district heating takes over the most important heating method of households. So if you look at the poorest income group, the first one, you can see that over 40% of them rely entirely on solid fuels. This can be because of the lack of access to other networks like modern heating services, because either the village or in many cases the segregated settlement where mostly Roma households are living, the energy services are just not reaching those disadvantaged villages and neighborhoods. Firewood heating is twice as relevant in the heating of Roma households, which also means, as we will see later, that they are more exposed to the negative health impact of this heating method. It's also important to highlight that solid biomass use is accounted at the European level as renewable energy source. So this polluting heating method of poor households is seen as a renewable energy source that helps member states to reach their renewable energy target. A few words about the heaters. In domestic settings, either there is a centralized heating system with radiators with a boiler, or there is an individual heater optimally in each room, and in some cases only in some of the rooms. The issue is that the centralized boilers can be really obsolete. They are really expensive to upgrade, so households rely on very old ones, which are not efficient at all. And in the case of individual heaters, they are differing in terms of efficiency. For example, the masonry heaters that you can see on the left down, they are much efficient and they provide a much comfortable heat, because as once the fire is lighted, then it distributes the heat evenly and keep the warmth for a long time, maybe over a 12 hours period, while the cheaper and less efficient stoves that can be seen like the others on the picture, they have not so good qualities, because when you put the fire, they heat up quickly, but then they also cool down very fast. So you might need to put on the fire even during the night. Based on the study of the European Public Health Alliance, I listed some of the most important pollutants related to solid fuel heating. I won't go into details regarding that, but you can read on the left side of the slide. But it's important to highlight that residential solid fuel heating is the largest source of fine particulate matter emissions in the European Union. So it's even more important contributor than transport. And there are 307,000 premature deaths occurring because of this. This is the data from 2019. And a number of countries, among that Hungary, has been ported to the European Court of Justice because systematically and persistently the limit values for particulate matter emissions are exceeded in the country in different regions, and these are not urbanized regions, but one of them, one of them is the capital because of transport, but also the Shayo Valley, which is a very beautiful rural area with hills and very poor villages. And there, because of the solid fuel heating, air pollution is really terrible. And also the geography of the place is not really helping, that the wind, because the wind cannot really clear the air there. And because of poverty, also households tend to use inefficient fuels. So what are the outcomes of energy poverty? Frankowski and Tirado-Herrero in their studies outlined that households that are living in energy poverty, but as first substandard housing conditions such as mold or leaking roof lead to cardiovascular and musculoskeletal diseases, so diseases related to muscles and bones. Being in energy poverty increases the risk to have respiratory diseases, and that risk is further increased if the household is heating with coal or wood. So there is a strong link, and it's also important to highlight that air pollution is not only happening through the chimneys in the local environment, so it's not only that the air in the environment is bad, but air pollution can already start inside the apartment because of the obsolete heaters and, for example, the tube that leads the smoke out from the stove. If it's broken or old, smoke can start to leak, or when the persons are opening the stoves, also if the aeration of the chimney is not perfect, then the smoke can infiltrate in the apartment already. Besides the different diseases related to unfit housing, energy poverty, and especially solid fuel usage, there are other risk factors that I would like to highlight. Fire cases can easily happen, especially if chimneys are not well maintained, and other injuries can happen during Christmas holiday. Friend of mine living in the countryside just called me, and she was really upset because her 16-year-old son just faced a really serious injury while they were cutting wood with his father, and he's still recovering from that injury. So also working with wood can be dangerous. I already mentioned indoor and outdoor air pollution, which is a very serious risk factor in terms of health. Then unstable temperatures because of the outdated heaters is also, in case there are children or elderly people living in the apartment, are not, and it's not comfortable for anyone to first experiencing extreme heat, then really cold in a few hours. So it's not good for anyone. And also because of the need to feed the stove regularly during the night, this is related to interrupted sleeping that has a negative impact on everybody's life, performance at work and school. And also firewood heating is, in order to heat with firewood, you need to have physical force and strength in order to access and proceed wood to store it. And in case of, for example, elderly women living in the countryside alone, this is highly problematic because they all the time rely on other people's help in order to be able to heat their home. And also it has a negative impact on the availability of free time of everyone that needs to take care of heating in the family, which are mostly the male members of the household. So after work, instead of having a rest, they need to continue to work physically on providing heat for their families. And finally, some solutions. So at FEANZA, we are working in order to influence the renovation wave to have a positive social impact. So we believe that the renovation wave must target the most vulnerable households first. And renovation strategies should be coupled with local heat transition plans that identify the most appropriate heating method that is locally available and is best fitting the housing stock, and also the takes into account the affordability aspects. Then it's also really important to support households to switch to clean, accessible, and affordable heating methods. Therefore, there is a need to invest public money in the heat transition of low-income households, because all the money that is invested in cleaner heating technologies will have a really important turnbacks in the form of health cost savings, and it will increase radically the quality of life of most vulnerable households. And besides of technical investments, there is also a need for social and technical support in order to include households in the energy transition and to provide them technical help in selecting the best appliance for them, and to guarantee that the new heating form won't put higher energy cost burden on them than the previous heating method. And here I really need to point out, I forget to mention in the beginning, but since the energy crisis, firewood prices has been increasing dramatically because of the energy supply issues, but most importantly, because many households that were already using gas, mostly middle-income families, started to switch back partially or totally to firewood. So the increased demand for firewood pumped up the prices of the price of the fuel of the poorest households that has no other alternative to heat. And finally, in the last slide, I just want to show some of the resources that are used. And part of my presentation is based on the study that I did with a colleague from Habitat for Humanity Hungary, on which is entitled Fear of the Poor, and I will share it in the chat, the link, so you can get a deeper insight into firewood use in 3 Central Eastern European countries. So thank you for the attention, and I hope I was not talking much longer than 10 minutes because I forget to put on the timer.
Yeah, thank you for sharing the report. I think it's really good report, and to read it. We have also a few questions, but we are going to ask in the round. But we are going to answer in the round table. So I will now announce Lydia, because after this east part of Europe, we are jumping to the Mediterranean, and Lydia Živić she is expert in focus. She has like 20 years experience in maintaining project in covering the thematic like sustainable development, climate, energy poverty, transport, consumption, and she will going to present actions that were done through the project of EmpowerMed, its Horizon project, and Focus is coordinating partners. So Lydia, the floor is yours. Anna, could you just stop sharing the presentation? And Lydia, then you can start yours. And we have questions already in the chat, so I'm really glad to have the round table. So Lydia, we are seeing your presentation. You can go on.
Great, thank you very much. Good afternoon, well, good morning, good evening to the different people from all over the world. I'm very happy to be with you today. Today, I would like to quickly present a project called EmpowerMed. It's a Horizon 2020 finance project, which is aiming at contributing to reduction of energy poverty in the Mediterranean countries. We are having 3, I would say, cross-cutting topics of the project. One is focus on women, another one is focus on health, and the last one is to focus on the summertime aspects of energy poverty. Within the project, we did a lot of practical activities to alleviate energy poverty. We did household visits with advising people how they can reduce their energy consumption. We did collective assemblies, which is a format where people basically empowered each other to tackle their situations of energy poverty by, for example, switching to a cheaper supplier and so on. We also implemented do-it-yourself workshops where people were either learning very simple practical methods of tackling energy poverty, or in some countries they were learning how the photovoltaic modules work and how they can be used to tackle energy poverty. Finally, we also had health workshops, which I suppose is the most interesting for this session today, where we either worked with health experts, frontline staff in the health sector, raising their awareness about energy poverty and how they can tackle it with some, let's call it first aid measures, but also where to point people for deeper measures and deeper support. But we also had health workshops in terms of supporting mental health of participants, where they were working with therapists to tackle their problems with mental health issues related to energy poverty. In the project, as I said, we focused on women, and from the perspective of the energy poverty and health, this focus is very important because physically speaking, women are more sensitive to different deviations from temperature than men. This is why they're more vulnerable to energy poverty. Also because of the caring burden that women still carry in most of the societies, they're more often related to home, they more often stay at home, and therefore if the home is not adequately warm or adequately cool, they're more exposed to energy poverty. Finally, also women's mental health is more under stress than men's because, for example, they're worried about not paying the energy bills, or they're worried about their children being cold at home. So this is bringing additional pressure on their mental health. Looking at the Mediterranean aspect when we cross-cut the energy poverty and health issues. We can see that although it's very counterintuitive, the Mediterranean countries tend to have very high winter mortality rates. This is mainly because they don't have proper heating installed in the dwellings. It's also more and more concerns raised because of the heat, because of extreme heat events. They're disproportionately hitting the most vulnerable, the most already marginalized parts of society who often don't have even access to any dwelling, or if they have access to dwelling, it's very poor dwelling, not insulated, with leaking windows and so on. The need for space cooling is more and more representing a burden for the mental health of people, because it's expensive and it's very difficult to cover the bills for example, for the air conditioning, and people are having problems with that. In empowerment, we did health research during our practical activities. So during all the household visits and collective assemblies and workshops, we were asking the participants a few simple questions about their health. And we, just for the purpose of the study, we actually divided the people affected by energy poverty are those who had to cancel some other basic needs, such as food, medicine, clothing, and so on. Basically, all the people that we're addressing in the research, they are to some degree or less or more affected by energy poverty, but we said the ones that are really affected by deep energy poverty, we will call the energy poor in this case, and the others not. So we were asking about how they evaluate their health, and consistently across the countries, the answers were that people affected by energy poverty feel that they have worse health than people not affected by energy poverty, as you can see from the graph. Then we also asked about long-standing illness or health problems. And again, people affected by energy poverty were more subject to long-standing problems than people not affected by energy poverty. Also, when it comes to mental health and well-being, we discovered that people affected by energy poverty were scoring lower, like in when it was question about feeling cheerful and in good spirits. It was worse situation by the people affected by energy poverty than the ones not. Also with being calm and relaxed, feeling active and vigorous, feeling fresh and rested, and also feeling that their life is filled with things that interest them. So we can see through our small research that energy poverty does affect both physical and mental health of people. We have several recommendations from the experiences and lessons learned in the project. We would see increased involvement of frontline health experts and staff working against energy poverty as a beneficial thing, because they're in constant touch with the people, and it's easier for them to detect the situations of energy poverty and maybe give some idea to people where they can go, give some ideas of what they can do in the first place. It's definitely necessary to have more research in terms of the nexus of health and energy poverty. It's still a lot of questions open which should be researched, and especially in the mental dimensions, the mental health dimensions of energy poverty, we should really need more recognition and action on this field. Also, as we could also hear from the previous presentation, we should focus on better air quality in the households affected by energy poverty, and also we should raise more attention from health workers for the households affected by energy poverty. So yeah, thank you very much. And if there are any questions, I'll be happy to answer them. And maybe just finally, I would insert you a link in the chat so you can visit our project and read the resources that we have in this field. Thank you.
Yes, thank you, Lydia. Shared it because I think that the data that you present, they also could find on the EmpowerMed site. So it will be great to have what other countries from Mediterranean have done and stay for the round table. And now we are going to jump to the one male, a second that we have on this event. He's Barnabas Cormondi. He's certified geographer, but he's interested in nature and humanity. He works for Hungarian Urban Knowledge Center, and he's going to present a well-based project. It's also Horizon project. I see in the chat that someone asked about this project, so I think it's great to be here and present us the well-based project. So the floor is yours.
Thank you, Anna.
And let's just share presentation with us. Okay.
Okay. Can you say it in
Yes,
full screen mode?
It's in the presentation mode.
Okay. So, welcome everyone. It's good to be here. And actually, well, a lot of findings or facts are already been told by you. So I will just jump through those which are really linked to the well-based. Yes, a well-based project is focusing on the health aspect of the energy poverty issue. And here I would like to first mention to the Europe aspects of the energy poverty, where according to the Eurostat in 2020, there were like 36 million people affected by energy poverty, or in more specific, they do not were unable to keep their homes adequately warm. On the figure, you can see that it mainly causes problems on the southeastern side of Europe, where the unaffected heating were a problem, but we can also say that the heating, the cooling, the lighting, or the mobility is also a problem, which can be the case for the Western European side as well. Well, as due to its complex nature, I mean, for the energy poverty, the development policies can sometimes be a little bit ignorance or negligent according to the energy poverty, because as it goes through several sectors, it cannot be identified how it can be solved or improved. So it eventually causes that the poorest parts of the population leaves behind, and it leads to the increase of social and spatial segregation. Well, the energy poor households tend to look for the cheapest available heating fuels, just like we could see in the presentation of Anna. And eventually it can lead to more pollution after the burning. So this means that energy poor households can not only affect their own health, but also the health of the entire urban settlement. We also have heard that what kind of diseases can be, or health problems can be caused by the energy poverty issues. And here I would like just to mention that although the physical ones can easily be recognized by someone, however, the case of mental problems caused in living energy poverty can be hidden for a long time. So as a non-stigmatized narratives can also link to the victimization concept, since energy poverty affects health, but since in most individuals the situation of energy poverty is considered as source of embarrassment, the problem remains hidden, thus worsening the negative effects of health. This was realized during the recruitment session of the participants in well-based project. So we can say that the complex nature of this phenomenon requires a comprehensive analysis of the problem and its solution for the multidimensional approach, which should involve environmental, political, social, and regulatory aspects. So turning to the value-based project, which is actually were launched to map the link between the energy poverty and health, and by analyzing the financial and business environment and possibilities, we try to find solutions to reduce and tackle energy poverty. We have 6 pilot sites, and Skopje is a kind of observer, halfly observer and halfly active participant of the project. Actually, because Skopje is joined to us right at the beginning of the implementation of the project. Well, the pilot, as you can see, covers all parts of Europe. So we hope that our findings can be utilized all over Europe and maybe beyond of it. The ultimate objectives of the value-based project is to design and implement and evaluate a comprehensive urban program for each of the pilots. And thus, using these kind of urban programs, we hope that significantly the energy poverty can be significantly reduced, and also to build on the research. We hope that we can build an evidence-based approach for each pilot, and to represent not only different urban realities, but also diverse range of welfare and healthcare models. So how we can implement it? We are at the first part, we carried out 7 urban programs in the leading of each of the pilots. They are created their own programs, leading by our partners, and during this, they identified how they would like to reach the participants who will be involved into the project. And also they worked out a common methodology to design these urban programs. And during this value-based project, these urban programs will be implemented until the end of the project. How we reach the participants? The project aims to recruit 1,750 people, and we would like to involve so each pilot differs from the number of participants they involve, but actually for now pilots are also still kind of, they have a hard time to doing the recreation, as for the first approach they have a kind of hardship to get people involved, as well, those pilots who have previous experiences with similar projects and have an existing network to involve people, so they can really easily get people involved into this project. But other pilots, even if they have a kind of good practice, how can they manage to involve people? There were no such kind of relations between the locals and the municipality, so they have a really hard time to get involved people, which is also a kind of well, symbol of the wealth of the mental health of this kind of people, this kind of vulnerable people. So according to our findings or the state of what we have, the people who joined to our project is mainly women, and if not, they are mainly living alone. They are elder people, and if they are young, they are together with children, so they are one-parent families. And actually, municipalities started to reach out people through social media, but it wasn't that successful, so they have to make effort to get in touch with physical contact with the provision participants. And sometimes they have to enlarge or expand the area from where the participants could be gathered. We also creating to involve people. We already carried out energy audits and tried to give people some training to make their homes more energy efficient, and already plan to hold trainings for housing improvements. And these are aiming for the focus group. And in this kind of group, there will be home monitoring sensors installed, where the most basic data will be gathered. And for both the focus group and control group, there will be regular questionnaires to check their status in energy poverty and their health, how they are improving, or in the case of control group, how they can survive in the case of energy poverty. And we are also gathering city level data to see how the local climate is and local air condition is infecting the involved participants during the 18 months research. We also carrying out a research for financial and business models to find the best ones, or if we have the already existing models, we try to improve them and and check their possible involvement into the project. And when we have the most promising ones, we try to make a combination of these models to get a solution where all the participants, I mean the private sector, the governmental sector, and the society can all win from this situation. So if we are going across these kind of steps to reach our main objective, hopefully through the policy recommendations, we can make a better solutions from local to EU level to tackle energy poverty and make the well-being of citizens improve. Yes, so that's all from my side. Thank you for your attention.
Thank you, Barnabas, how you put it in the email. I think it's really great that you share the data with us, and I think that for the roundtable we will have a few questions. For that now, I will jump from Europe to Nepal, and I will announce our last speaker, Karuna Bairachi. She's from Nepal, and she works for Clean Cooking Alliance. I think that her presentation will be really good from Europe for Burkina Faso to see what is action and doing in air pollution from the cooking, and this is her main expertise in solution for the air pollution and clean cooking. So Karuna, the floor is yours. You can share the presentation. Okay, great. We see now, just put it in the presentation mode. Great. Yes, we are seeing. Hello. Yes, great.
Good afternoon, everybody. This is Karuna from Clean Cooking Alliance in Nepal. So my presentation, I would like to start with like a clean cooking fuel usage status in Nepal. So I'm just comparing from census 2011 to 2022. 21 is like a little bit unpublished, but I managed to get data. So it will show that like a firewood uses like less than up to like it will lessen by around 10 to 11%. But however, like there's a massive fuel wood use in the country, and LPG has like picked a rise. Basically, this is the lot of migration in urban areas, so people are using LPG stove. And if you see the electricity part, it's a quite little bit slow, because like I might clarify that like when we had a census questionnaire, there's a not specifically mentioned like how much electricity used for cooking, so that's why it's a little bit less. But now like most of the urban population is around it is estimated 5% people are in the urban population is using electricity for cooking. So cow dung, it is like decreased by around 8%, and biogas, it is decreased by 1%, something like that, because the biogas is it is already saturated in the most possible areas, and some areas in the Tarai it is possible, but due to this remittance, like people go outward for earning, and very low member of like older elderly people in the community, so it's and the size of the biogas, these has some many consequences that like biogas uses like a lesson in this census. Like kerosene, it's a now it's a less, it's almost like a kerosene is no more subsidized in Nepal since like 20 years. So people have started not using kerosene for cooking, and others is like 0.10%. So that's how I started my presentation. So so in the background, there are several different practices in Nepal due to rich diversity of cultures, geography, and wealth distribution. Because we divide Nepal into 3 ecological zones, like high hills, where all the Himalayas, mountains, and mid hills, where like there's a lot of like it's a population, densely populated, then the high altitude, and the Tarai is a densely populated, where the it is a plain tropical area. So and we have like so many ethnic groups. So we have Tamang, we have Newas. Also, altogether more than 25 ethnic groups lives in Nepal. So they have a different range of cooking style. So that's why like it's a rich in diversity. And according to 2011 census, that Nepal has 80% rural population and 7% urban population, but it is little bit converted into like a it has raised like a urban population is raised to up to 30%. So it is not populous. That's why I have not here. And so in the health burden, there's a substantial evidence from both global and Nepal's study that long and short-term exposure to high levels of household air pollution damage health. So in 2019, approximately 20,000 deaths. Now it has reached like something like 22,000 deaths, and 650 disability dialysis are associated with the exposure of household air pollution in Nepal. So high level of blood pressure in most significant risk factor contributing to rise in Nepal's cardiovascular disease. And clinical and epidemiological evidence suggests that even most 1 mm reduction in systolic blood pressure can help prevent the cardiac mortality. So in the like CCA had like a demonstration project run from 2017 to 2019, where we have like research in 772 households. So the primary cooks living in community affected by intervention activities, so experience size of 3.34 mg. And like around reduction in systolic blood pressure after adjusting change among cooks measured outside the intervention affected communities. So a more modest and insignificant increase in diastolic blood pressure was measured among cooks affected by intervention activities. So related to those living outside the intervention activity. So this project has applied social technology intervention strategy support the wide scale uptake of clean cooking practice. So I'll share you the link for this study, like a summary report of this study. So, and in Nepal, acute lower respiratory infection is major cause of infant mortality. So based on study conducted among the population of Bhaktapur municipality, Nepal used the biomass as a household fuel as indicated a risk factor of ALRI in young children. So this is like a severe case because in the kitchen, like mostly women carry their children while cooking, and basically the Bhaktapur area is a very fertile land, and there's a farmers like many farmers live in that area, so they use almost a loose biomass for cooking, like because they consider that is a free fuel for them. So it has significantly impact the children also. So, and chronic COPD, lung cancer, ischemic heart disease, stroke, and other illnesses are linked in higher household India, and Nepal. So because as you saw like my graph that like a around now it's a data is like a 66% of Nepalese population living in rural areas still use biomass for cooking. So because the biomass is free among like we do have a like successful community forestry program. So there's a access to forest is like a very easy, and people can like gather fuel wood from their community forest, and even like annual collection is there, and it is for free for the family who is like associated with the community forest. So that's how people are using firewood. And in Pokhara, Nepal, the use of indoor biomass fuel, particularly as a source of heating, so the tuberculosis in women. So this is also studied in Nepal. And for women in from 35 to 70 years, those who without kitchen ventilation were 90% like more have a cataracts and those ventilation, because in Nepal, like it depends on the like kitchen is considered as a like a private space for Nepal, so they don't want to cook outside, so they have a like kitchen, and wherever the space heating is, so people used to have like small sized kitchen, and they have a literally no ventilation or small ventilation, so that is also affecting women. So this is a kind of a energy poverty in Nepal. So I'm like in past 25 years, the government of program has like promoted improved cook stove, which is like you can see in the picture. This is the 2-pot or mud brick stove, which is like 1.4 million stove were distributed, like disseminated during the period, and this is like basically meant for like evacuating smoke from indoor to outdoor. So that does not significantly reduce air pollution, but it is somehow it's less pollutant. But now since the Nepal has like going to have a surplus of energy, so we have a lot of hydropower project coming. So electric cooking is one of the win-win situation for Nepal, but still there's a transmission and distribution network is not that reliable. So only in the urban centers, in industrial corridors, there's electricity, reliable electricity, but in the rural places still we have a problem. So that's how like electric cooking is started from since like 2018, once we overcome the load shedding. So now people are gradually using electric cooking in urban areas, very urban areas, but still rural areas people are predominantly using biomass stove, and they have a LPG in house, but that is LPG is considered as a aspirational stove, because like transportation wise LPG cylinder is difficult to carry, and it's they have to pay per cylinder, so it is around $20 per cylinder. So that is like a people consider as expensive. So they use as a partial, like for only water heating, those kind of, but the 70 to 80% time they use firewood for cooking. So that's how that's our. So this is the reference that I have taken from different sources, and you can also see the Clean Cooking Alliance report on this health benefit demonstration project.
Thank you, Karuna. It was really great to see what is going on, and your presentation kind of wrap up all the data that present project empowerment, well-based, that focus on the woman. You said that also women are the ones that are more doing the cooking, and I think that it's really nice that we put that focus here, not only on energy poverty and health, but also as a woman, as the problem that are more in that endangered environment to do it. So for us, I will just to see all my speakers with cameras on, so we can do the final roundup. I see that some of the question you already answer in the email, in the chat. So for the final closure, I will ask Teresa and Anna and Karun, because you both work in like chimneys problem with the heating system and fire hazard. Do you think that after this energy crisis, it will be more increase in, like Teresa present, that people start using barbecue to heat their households? Is it something that we should more focus in? Maybe this winter is over, but next winter that could be more problematic. So give us like 30 seconds each of us to answer, because we are on time.
Anna-Marie, can I just share? We've shared it in the chat.
Yes.
But we have, oh, of course it won't come to the background. We have linked energy poverty and fire risk, and it's on www.feedsnet.org. The reason that we did this was the day after the tragedy of Grenfell in the UK. And can I just say thank you? Hearing these stories from around the world is very, very uplifting and very worrying, because we've actually got to do something about it. But after the tragedy of Grenfell in the UK, where people died because a tower block was cladded in the wrong materials that were not fire safe, we wrote in Europe fire safety into the Energy Performance of Buildings Directive. And it's just a thought that all of this work that we're doing in energy poverty, so Anna in Hungary, are you informing the Committee of the Regions? Barnabas, what you were saying about isolation, Bastion, what you were saying about the importance of local authority involvement. Because Barnabas, we know, I was a city councillor, I'm not going to reach in consultation my poorest citizens because they don't have Wi-Fi, because they can't afford it. So there's a real importance of having locally trusted one-stop shops that are accessible, that can give people information. And we have to work on prevention. And Karuna, when you were talking about the safety of cooks. Not everybody thinks about the safety of firefighters when they actually go into these situations. So if I could ask you all, and also we will contact CATA and Horizon Europe. Glad to see Leeds still in there, even post-Brexit, that we actually need to combine measures to combat energy poverty with fire safety. And Anna, what you were saying, thankfully, about the move to electrification in Hungary, we've got to make sure that the move to electrification is fire safe. We have a duty to protect our poorest citizens and to keep our local community safe. Thank you.
Thank you, Teresa. So Anna, Karun, do you want to add something more to see about the future, what is going on with energy crisis and fire safety and air pollution because of usage of more wood in the households?
Maybe I can shortly say that in Hungary, in news, it has been reported that chimney fires has been occurring more often. In general, 1/5 of fires in homes are happening due to chimney fires that are not well maintained. Recently, chimney wiping is not mandatory any longer. It's free, but it's just an option for families to do it. They are not forced to do it. And if they are not taking care of it, that can easily lead to chimney fires. And I also would like to thank Teresa for the idea to get in contact with the Committee of Regions, and also highlighting the electricity safety, because providing electrification to the households that are living in the worst dwellings, it's not only a risk of increasing electricity costs, but if the house is not renovated entirely, then and the electricity network is old, then it can be also highly risky, I guess, to just install a heat pump and then let's wait whether the system can bear it or not. So these are really important aspects to be.
Thank you, Anna. Karuna, do you want to add something?
In Nepal, like I mentioned, the electricity is like going to surplus, but still I mentioned that there's a issue of transmission distribution, a lot of investment needed for the government of Nepal. So, but still, like I mentioned, like firewood is free found fuel for, like it's a free for them. So that's why changing behavior and the pushing awareness level, and even like providing with highly efficient stove, like with the safety measures, this is the major concern for Nepal. And even we do have to import LPG from India, so it's not that cheap. So Nepal has to like do a lot of work on like pushing the clean energy, and even like safety and energy poverty, because people consider that electricity is expensive energy. So once they connect with the electricity, but it's for marginalized people, it's very expensive. That's why they consider like firewood is free. So it's good that like this community is like acting, and I would be very happy to contribute and get your ideas and like work together. Yeah.
Thank you, Karuna. I will maybe postpone like 3 minutes more, because I have like 2 questions for remaining speakers. One question is actually come from Batizon. When we talk about, she's really interesting, so we'll cover Kormandi Lydia. You can answer to her how it's for you to gather data about health and mental issue. It's problematic because people are not responsive to share data in the survey. Could you maybe like give us Kormandi and Lydia 1 minute review what other countries like Nepal and maybe New Zealand and Israel, how they can gather data, because I know that we have also problem in Europe. So just 1 minute more, and then I have one question from New Zealand for Nina.
Okay. As far as
so it's for Kormandi Lydia. So, but Karuna, if you have also idea how you gather data for your country, it's fine to share it. Yes.
No, actually, yeah, I can understand like people are surprised, because Nepalese are very open and there's a very homely. So once you like inform, when we use a questionnaire, so we'll be asking and we'll be this thing. So they are more happy to share. Otherwise, like I've seen for US and European countries, like they don't want to share that. They said that it's private matter for people. But
especially health and mental, yeah.
Yeah. So yeah, it's depends on the culture. So
yeah. So I'm really glad to see how Kormandi and Lydia gather, because Batizon, she said that they have problem in Israel with gathering data. She can also add what is their problem. So could you Kormandi share us how you do it in your project?
Yeah. So actually, just in short, we will do questionnaires, and also for the health measurements, there are pilots who can make, so they have to go to the healthcare center and make every month do a short examination, like blood pressure, health rate, and these kind of easily measurable things. And they are questioned about their sleeping habits. Is there anything wrong with it, or sleeping quality? And also, in every 6 months, there will be questioned about how their energy poverty or how their living circumstances are developed or not. But yeah, we have a problem with at the first time to create a really deep and overarching questionnaire, but it was really tricky because most of the promised participants do not want to make like 1.5 hours with questionnaires. So they dropped out, and we had to shorten the questionnaires to make it feasible for them.
Yeah, I think that also Lydia, because Croatia is part of the European Empowerment Project, the same. The short, when you want to cover energy poverty and health, it is a problem. So Lydia, how we managed in Empowerment Project?
Well, we certainly had to shorten our initial idea of the questionnaire because it was over 1.5 hours long, and we knew that participants would not take it. So yeah, we faced quite some challenges. Like actually in the section for health, for Spain, we had to totally omit the analysis of the country because people were simply unwilling to respond to the questionnaire. It was very important to actually work through anyway, in the first place, for accessing to people, it was important to work through stakeholders and actors that people trusted, such as social services or youth associations and so on. So basically accessing people through these trustful actors was increasing trust in our questionnaire, and that's why some people answered. But it was a very strong tendency of people not wanting to answer the health questions, and especially the questions related to the mental health. We struggled a lot there. This is why, yes, we need more research, but we also need more insights into methodologies for research, because we might need to reshape our methodologies as well. Thank you.
Yeah, thank you, Lydia. Yeah, because Barnaba is also doing the physical examination. They're going to do the blood pressure, so it's really nice to do it. But I think that, Batizon, did we answer your question? Because I think that in Israel you're thinking about doing some kind of survey, and yes, there is problem. Like in Nepal, she said that Karuna, that they are more open, but in Croatia, as a part empowerment project, we use the Red Cross because survey people who are they are more open to someone that they knew, and they knew the Red Cross. So it could be maybe idea for all the audience if they are questioning how they do the survey. So I hope that Batizon will answer your question. That was really, really interesting to do it. Okay, and for Nina, my last question for the New Zealand, and I know that you are in the end of the day. Even Batizon, did you want to answer? Okay, because something with internet. So Nina, for the maybe last, you start with the first with Teresa, but the last question about New Zealand, you talk about shortage of electricity, something that also Jakuba mentioned, that they have problem with hospitals, that they don't have access, and you mentioned that there is also in New Zealand problem in generators, especially when you are hit maybe like with this cyclone Gabrielle that you have. How you do the survey, and what is the next steps for that?
Thanks for the question. Yeah, I mean, interesting to mention Cyclone Gabrielle, which is something that we're feeling very strongly at the moment in New Zealand. It caused flooding, which has wiped out a lot of communities on our east coast, and it has presented a real energy poverty issue, or a sort of unusual occurrence of energy poverty, where a lot of households have lost power. Households that weren't previously in energy poverty, and we're also having issues with running out of fuel at petrol stations. Petrol stations also losing power, so sort of layer upon layer of energy challenge in those areas. And certainly it is raising some questions in the sense that I mentioned that we're looking at moving people towards electricity as a cheaper, more affordable and efficient form of heating in New Zealand. But as we do that, we give up people's ability to rely on locally sourced solid fuels, for example, as a substitute for times when there is a crisis, and we're certainly expecting to see more of this type of thing. So yeah, it's making that energy poverty question much broader issue in New Zealand at the moment.
Yeah,